Living well. Living well really is the aim of any of the human being in our life, starting from any child patient to any other to growing patients. So what we'll try to do in our program is to give you the medical information in a very light meal and in a very simple way and language. We'll try to discuss about diseases, the causes of the diseases, the symptom of any disease, and then we'll finish by trying to treat or suggest any treatment for those diseases. So the aim of Living Well is not only yours, it's also our aim in our program to give you a very light meal of medical information in a very simple language. Hi there. Well, there is a number of rare diseases, as we all know, in the medical field. Actually, the definition of the rare disease, usually it is the disease that the percentage of the population affected by it is really something very low. Today I will speak about one of the rarest disease, which involves the wall of the blood vessel and the lymph vessel, which is what we call it Kaposi sarcoma. The Kaposi sarcoma, actually it is a number of a tumor, or let's say a multiple tumor that usually involve the blood vessel lining wall and the lymph vessel lining wall. It might appear anywhere in the body, but most commonly it will usually be like a purple to pinkish discoloration, let's say like a lump or a bump that usually will be in the face, upper limb, and even sometimes it might be inside the GI system. Kaposi sarcoma, actually it is one of the rarest complications or one of the rarest sarcomas in the whole population. The percentage is really something very low, and it mainly, as I said, affects the lining of the blood vessel and the lymph. The underlying cause of Kaposi sarcoma, actually it is a kind of virus that we call it human herpes virus number 8. The HHV number 8, usually it is the underlying cause of Kaposi sarcoma. Unfortunately, patient with HIV infection, which is the AIDS or the immune depletion, let's say, syndrome, usually will have a very higher chance to develop Kaposi sarcoma compared with other patients or other population. Another also category of patient that usually will have a higher chance to develop Kaposi sarcoma are the patients who underwent transplant operation, like for example kidney transplant or liver transplant. Those patients with history of transplant surgery usually will have a very low level of immunity due to the fact that they are taking what we call it some medication to decrease the side effect or to decrease the rejection of the transplanted organ. So those patients, along with patients with HIV infection or the AIDS, usually will have a very higher chance of Kaposi sarcoma development. The diagnosis of Kaposi sarcoma usually depends on the symptom that the patient will have. As I've already mentioned, that there will be a multiple, let's say, lesion along the course of the lining of the blood vessel or the lymph, and most of the time those, let's say, lesion will be purple in color. As we've already mentioned, that they might appear on the face or upper limb or even inside the GI system. Well, from that point of view, the diagnosis of Kaposi sarcoma will depend mainly on the side effect of the tumor or the localization of the tumor. Most of the time, doing a simple fecal stool occult blood test will detect some blood in the stool, and from that point of view we might let's say have the diagnosis or reach the diagnosis of Kaposi sarcoma. Another, let's say, tool by using, let's say, more radiological, let's say, technique is by doing a simple chest X-ray. Usually a simple chest X-ray will indicate that there is a multiple lesion in the lungs, and those lesions, as I've already mentioned, might be something related to the blood vessel or to the lymph vessel. Another tool also, which is a more aggressive one, will be either doing an endoscopy or a colonoscopy. Both of these diagnostic tools will aim to visualize the abnormal part of the GI system that usually will develop Kaposi sarcoma as a complication. The management of Kaposi sarcoma will depend on many factors. One of the first important factors is the association with that specific, let's say, soft tissue sarcoma with any underlying cause. For example, as I've already mentioned, it is very common in patients with HIV infection or AIDS infection or AIDS disease. So those patients, we should control the underlying cause, which is the AIDS. And thanks God, due to the recent, let's say, development in the management of HIV patients, most of those patients will have less, let's say, chance to develop Kaposi sarcoma. Another thing which is very important is the location of the, let's say, Kaposi sarcoma lesion. Actually, the location of it will determine even not only the management, but the prognosis of the disease, depending on the location, the extent of that, let's say, lesion, along with the other complication related to the disease itself. The general health of the patient. Usually will determine the first most, let's say, line of management, and should we be more aggressive or gentle. Most of the time, Kaposi sarcoma will require management depending on those factors that I've already mentioned, but the prognosis of the disease, usually it will be mild to moderate. That means that the chance to cure from the disease will depend on the underlying cause. Unfortunately, some of the patients will have serious side effects due to Kaposi sarcoma, and most of them, might have some lymph vessel blockage along with blood vessel blockage, and all of these might lead to a serious complication. Actually, one of the most serious complications of Kaposi sarcoma, that whenever we have a blockage of any lymph vessel or any blood vessel, usually the supply of the blood to that specific area will be end, and the drainage of that also, let's say, specific area will be blocked. So these blockage of those blood vessel and lymph vessel will have a serious side effect. Along with all of these, the most important thing is the follow-up of the patient. If the disease is mild, we might not intervene, or we might not even give some medication, along with, observing that, let's say, disease, and just keep the patient under close observation.